start.
So during our practical session, we talked about a couple of concepts. One, we talked about trying to assess whether our patient was in a neutral spine position. We were then trying to look at whether or not they had good activation in their glutes and assessing the length of their hip flexors, which is kind of the easiest way to determine if we've got a lower cross pattern, which is one of the most common things, which is going to create facet irritation leading to arthritis and on and on. So we're going to demonstrate how we may be able to quickly involve all that stuff within the confines of a typical chiropractic assessment. So we're going to get our patient to stand up here. So if you're doing a regular postural screen and have you stand in front of the mirror, you can do whatever normal postural checks you're looking for, asymmetries, anything like that. Now I'm going to have you turn and face the wall for me. Looking into the mirror, we can make comments on excessive lordosis, looking at belt angle, assessing PSIS and ASIS, looking for tilt of the hips. That's probably something that you're doing already. The only change we're going to make is I'm going to have you back up just a little bit for me, and I want you to lean into the wall so you can have a little bit of an angle at your hips. And then from this position, I want you to try to tilt your pelvis forward as far as you can. Good. Tilt your pelvis backwards as far as you can. We're going to do that 2 or 3 times each side. So now we're looking to see how much movement they have around the hips. And I can even put my hand on their back to look to see how smooth that movement is. Is it very shaky? Is there a lot of vibration? Obviously, if the patient has any pain, that'll give us some indication as to whether or not there's issues going on. We want you to take your hands off the wall now and cross your hands over your shoulders. We'll maintain that same kind of forward bend, and now we're going to repeat the same test. Tilt forward, and then what happens there? So now he can see what's the difference between on the wall and off the wall.
It's shaky.
So he's shaky way more off the wall. The wall gave him a little bit of stability. Now without that stability, we can see that the shake happens. That's telling us we've got some hypertonic low back muscles. The coordination of the muscles around the spine are not optimal. So then from there, we're going to come grab a seat onto the table. So let's lay on our back. Good. We're going to walk our feet in. We can put our feet on the table, cross our hands over our shoulders. And very simply, our instructions to the patient are going to be, I just want you to lift your hips up off the table. Obviously, if this causes any pain, stop right away. As we're in this position, I want you to internalize and think what muscles are doing most of the work to hold you in the air right now. Any pain in this position?
No.
If they don't have any pain, we're going to challenge them a little further and say, I want you to balance on one leg. Can we try to straighten out one knee for me? We're going to hold that position for a couple of seconds. Again, do we have any pain and what is doing most of the work? We would compare that to the other side. Very good. We come back down. We're looking to see, does their pelvis dip? Do we see one side dip when we come down on one leg? And let's come all the way down back onto the table. What muscles do we feel working the most to do that?
Glutes.
Glutes. Excellent. The answer we're probably going to get most often from patients, hamstrings, quads, low back. You'll hear all kinds of different things, but we're assessing to see, do your glutes fire to create hip extension? Turn onto your side and come sitting all the way up. We're going to come standing all the way up. Okay, and then we bring the slide the table off to the side just for the purposes of the camera. I'm going to have you come and sit at the very, very, very edge of the table. Actually, hang on one second. Let's move this back just a little bit. Good. Sit at the very, very edge of the table. You're going to bring one leg in nice and close to your body. Get as far forward to the table as you can. Good. I'm going to help assist you come all the way back. So we're going to lay all the way back onto the table. All the way back, all the way back, all the way back. Good. You're going to flatten your back against me. So you're going to try to crush my hand. Good. Just nice and easy. And then we're going to let this leg die. Die, die, die. All right. So with the back flat, we're looking to see the center of your knee is above the center of our hip, and our knee is not quite at 90 degrees. It kind of springs on us, so we're a little tight through our quad, tight through the upper part of the quad, the hip flexor. In an ideal world, we want to see that knee hang closer to 90 degrees with that knee below the center of the hip. What do we feel as we do that?
Just stretch.
Stretch through the front of the hip and the front of the thigh. We're making sure that that low back angle stays flat. So again, we're just looking at assessing the length of the hip flexor. We can compare that from side to side. And again, in bad cases, you're going to have patients that come in with that leg way in the air because of that chronic hypertonic hip. We're going to bring legs both in, keep our core neutral. We're going to try to keep our back perfectly straight as I help you up. We'll come all the way up. Very good. So very quickly, within the confines of a chiropractic office and a regular assessment, we can quickly look at, do I have a good neutral spine position? Can I control the position of my spine? Do I lack good coordination of my core muscles? Can I activate my glutes, and do I have overactive hips? From there, we'll be then able to prescribe some corrective strategies. And that all doesn't have to happen on one day. You may do that assessment as part of your normal routine, and then throughout visits, during adjustments, you can talk about foam rolling one day, talk about glute activation another day, talk about hip flexor stretching another day. If you don't have kind of a rehab model, it doesn't have to happen all in one long session. It can be paced out through your normal treatment plan.